Good afternoon, everybody. Today is February 24th, and we are here with Christine Noor. The topic of the day is a hot topic. We had a lot of people register for today's community chat on eating disorders. So we're going to be talking about different eating disorders, and please don't forget to ask all your questions. So use the Q&A or the chat box and just ask as many questions as possible. As a matter of fact, it helps me a lot when you ask questions, because then I don't have to ask all the questions myself, so you're really helping me when you do that. So don't be shy and start sending your questions. And, we have a very extensive theme today to cover. So we're gonna get started, and let me introduce Christine Noor. And Christine, do you wanna tell us a little bit about you?
Sure. Yeah. So my name is Christine Noor. I own a private practice called Christine Noor Psychotherapy Associates, and we're in New City. And we're a group of 5 therapists, all who specialize in eating disorders. And I started this practice about 10 years ago, and probably in the end of 2019, found that there was just too much demand for me to keep up with on my own. So I decided that I really wanted to hire someone who was also an expert in eating disorders to work with some of the clients here, and to also, have an individual, a caseload of individual clients. And I wanted to just find the perfect person. So my colleague, Nancy Graham from the Renfrew Center, reintroduced me to someone who I had met years ago named Bernadette Kowalczyk. And Nancy knew that I was looking to hire someone, so it just worked out kind of perfectly. Bernadette's wonderful, super experienced, really an expert, has a lot of experience in eating disorders and is very well known in the area. So I decided to ask Bernadette if she would join my practice. And unfortunately, unfortunately, I guess, that was at the beginning of, COVID. That was March 2020. So, but it was fine. And we actually found that we had really more people looking for help than she and I could both handle. And so I just hired more people from there. And so now we have a group practice, and yeah, it's been a great thing. Mm-hmm. So I got my start in eating disorders, probably in 2008, working individually with teens it was a community mental health center. I had all kinds of teens that I worked with, those who had issues, depression and anxiety and behavioral issues and substance use. And I also had some folks there who had eating disorders. From there, I started working at the Renfrew Center, which is a well-known eating disorder treatment center. From there, I was able to start my own program at a community nonprofit, and was the director of their eating disorder program there. Did that for 7 years, also had my private practice here, and it just kind of went from there, so.
Yeah, so you've been very busy, and I'm so lucky actually to have found you right here, because eating disorders is something that a lot of people worry about, and to have such an expert right around the corner is just unbelievable. So let's start our talk. What is an eating disorder, Christine?
So eating disorders are extremely complicated mental health conditions. I think one of the greatest misconceptions is that it's really just somebody who wants to look a certain way, right? And it's a lot more complicated than that. Mm-hmm. Eating disorders really involve, usually someone who has a pre-existing mental health condition, an anxiety disorder or a mood disorder. Sometimes will start out, what I see most often is someone who is starting out with maybe a bit of a diet, wanting to lose some weight, wanting to maybe eat healthier, something like that. And for some people, it gets out of control very, very quickly, right? Really can develop into a fear of food, of eating, a lot of issues with body image and things like that. And they can be extremely complicated.
Are there people who are more prone to suffering eating disorders? You just mentioned that there might be people who already have depression, anxiety, but is there also like a personality trait that?
Sometimes someone who struggles with perfectionism, sometimes people pleasing, sometimes a sort of rigid cognitive style or interpersonal style. These all are things that put people at risk for developing an eating disorder.
Mhm. How common are eating disorders?
Extremely common. And I would say a lot of people who suffer with eating disorders maybe don't know that they have an eating disorder because of so many misconceptions, right? If someone doesn't fit the profile of what we might normally think of when we think of a person with an eating disorder, they might think, well, that's not really me, so I don't think it's that bad, or I don't think I really have an eating disorder. But it's really important for people to know that people with eating disorders come in all shapes and sizes, all ages, all races, all backgrounds. And if you think that, food and body image are causing you distress and problems in your life, then it's bad enough to get help.
And when you say food and body image is causing distress, like what are some of the warning signs? Like what should I be looking for or feeling in order to know that I might be suffering or seeing someone who has an eating disorder?
Mm-hmm. So thinking a lot more about food than other people, really obsessing about it. Food sort of in what you can eat and things like that, limiting what you can do in life. Things like not being able to go someplace or do something because you don't know what's going to be served there, right? Thinking a lot about the calorie content or other things, about the content of the foods that you eat, not being able to eat a lot of different foods, not being comfortable with a variety of foods, not for health reasons, but because it causes a lot of anxiety. If you see that someone is restricting, that is not eating enough, is doing, I guess what we call inappropriate compensatory behaviors after eating. So doing things like over-exercising or fasting or misusing medications or vomiting, things like that that interfere with digestion or weight gain. If someone is spending a lot of time thinking about the way that they look and it's really causing anxiety and it's limiting, again, what they can do in life, these are all warning signs that something's going on, that this is a problem.
Mm-hmm. Now, there are different types of eating disorders, correct? What are those types?
So I think that we normally, right, that the eating disorder that we think of most is anorexia nervosa, right? And that's actually the least common eating disorder. So someone, believe it or not, someone with anorexia nervosa normally will restrict the amount of food that they eat relative to their dietary needs. Usually they have a fear of gaining weight, even if they're not, overweight or anything like that. Sorry, I just got distracted for a second. I got a notification on my screen. Sorry.
So there is anorexia. What are the types?
Right. We often think about bulimia as well. And that is not just somebody who vomits after they eat, but there can be a lot of different things. Usually somebody with bulimia will binge eat, right? Eat a lot of food in a short period of time, and then engage in some kind of behavior, an unhealthy behavior that's going to interfere with digestion or weight gain. So again, that can be fasting, vomiting, misusing medications, over-exercising, things like that. Binge eating disorder is actually extremely common. It's not something that we talk about very much. But folks with binge eating disorder will eat a large amount of food in a short period of time, often feel a lot of embarrassment and distress about that. There's also avoidant restrictive food intake disorder, which is kind of a newish diagnosis. Not that it's actually new, but it's newly named, I guess you could say. Avoidant restrictive food intake disorder, or Arfid, is somebody who restricts what they eat based on sometimes something about the food that's really unappealing. So not being able to tolerate certain textures or colors or smells or something sensory about food sometimes. They may have a fear of something bad happening if they eat certain foods, choking or an allergic reaction or things like that. And that fear keeps them from eating a lot of different foods. And sometimes people with Arfid also simply just find food unappealing, or they don't know when they're hungry. So folks with Arfid may become dependent on ensures and other supplements in order to maintain an appropriate body weight. Usually they're not concerned about weight, shape, size, body image. It's really just food itself that can be problematic for them. So sometimes that looks like extreme picky eating in children that they just don't grow out of. A lot of adults have Arfid, which can sometimes limit, what they can do socially, or they may find themselves ordering from the kids menu and feeling bad about it, things like that. They have an extremely limited repertoire of what they can or will eat. So that's that. Really, the most common eating disorder is other specified feeding or eating disorder, or eating disorder not otherwise specified, which is can be a combination of different symptoms and behaviors from the different diagnoses. And sometimes people who have that diagnosis will think it means that they don't actually have an eating disorder, or that it's not bad enough. I really want people to know that that's not true at all, and that it's really, really common. As human beings, we don't really fit into these little categories, these diagnostic criteria, because we're human, right? So that's really the most common eating disorder.
How, because as you're talking, I'm thinking, I'm a registered dietitian by profession. So of course, we educate people on how to count calories. You just said, some people get obsessive about counting calories and all of these. So I'm feeling there could also be like a fine line, right? Between, yes, okay, I want to watch my weight and I want to watch what I'm eating, yes, and then going into an eating disorder. So where is that fine line? Where does it start that gets out of hand into an eating disorder?
It is a very, very fine line. And I think what you're describing is what we call orthorexia. It's not an official diagnosis, but I think it should be. It's really an obsession with healthy eating. So someone who has to, who really counts calories, has to eat things, for example, that are all organic or fit a certain type of, healthy eating, that kind of thing. And it is a fine line that can be crossed pretty easily, right? When it becomes an obsession, it really limits what you can do in life. When it leads to health problems, which we can get into, that's when it really starts to cross that line.
So yeah. I'm starting to feel that anxiety plays an important role in all these diagnoses. It's like, I can be okay until I start feeling anxious about my behavior and what I'm eating, what I'm not eating. And would that be the trigger for the eating disorder?
Sometimes, yeah. There's a lot of neurobiological stuff that happens in the brain of someone with an eating disorder, where some people, due to their neurological makeup, actually feel less anxious and more calm sometimes when they're engaging in eating disorder behaviors, right? Initially, right? And that's for some people how it spirals out of control, right? So they initially may feel calm, they may feel in control, they may feel less anxious, but really in the long run, it's actually going to cause changes in the brain that will make them more anxious, more depressed, less flexible, etc.
How dangerous can eating disorders be?
Extremely, yeah. And actually, eating disorders are the mental health condition with the highest mortality rate, which people don't really realize a lot of the time. They can be extremely dangerous. Someone with an eating disorder can have an electrolyte imbalance that can cause a heart attack. Someone who engages in self-induced vomiting can rupture their esophagus. People with eating disorders are at risk for malnutrition, dehydration, a lot of different health problems, even really long-term health consequences. For example, osteoporosis or osteopenia. Someone who doesn't have enough body fat to store the estrogen. And estrogen really protects our bones. And so if someone is, for example, not getting their menstrual period, they may not be realizing that the longer that goes on, they're really putting themselves at risk for loss of bone density.
Mhm.
Yeah.
How did you diagnose an eating disorder?
Oh, so there's diagnostic criteria in the DSM-5. In our practice, we do a comprehensive assessment. We're not only screening for the eating disorder, but all mental health conditions. It's a comprehensive assessment. At the end of the assessment, we share our clinical opinion as well as our recommendations for treatment.
Mhm. When do you think it's important to look for help?
As soon as possible. Early intervention is really, really, really key. So if you find that you or your child or someone that you know seems to be struggling, or maybe they're in the beginning of a struggle, that is the best time to get help. The earlier that the person gets treatment, the better the prognosis, the less time it will take for them to recover, et cetera. So yeah, as soon as possible.
Mhm.
The longer, oh, sorry.
No, go ahead.
The longer an eating disorder goes on, the more intractable it becomes, the more difficult it is to treat and the more difficult it is to overcome.
So Christine, tell us a little bit about the treatment. Is there a different treatment for each eating disorder, or are they all treated the same?
Sure. So to some extent, they're the same, right? Some of the treatments work pretty well across the board for most eating disorders. So cognitive behavioral therapy, dialectical behavior therapy, things like that are very, very effective in treating eating disorders. It really depends on the person and what their individual needs are and their whole background and what they're struggling with and really what works best for them. Our therapists really integrate all different kinds of treatment kind of seamlessly into each person's therapy. I would say that there is a very specialized kind of therapy that we do. It's called family-based treatment. And it is an evidence-based treatment that has been developed and studied specifically for adolescents with anorexia nervosa, but it can be adapted to different populations and different eating disorders. It's very, very effective. It involves getting really the parents and the whole family involved in the person's treatment so that they can help their child to recover at home without having to go to an eating disorder treatment center.
Mm-hmm. Can you explain a little bit more about the therapies that you were talking about, cognitive, behavioral, and dialective?
Sure. Dialectical behavior therapy, or DBT, really offers a set of skills to the person to deal with, for example, better ways of coping and better ways of managing emotions and regulating emotions. So being able to, for example, learn new interpersonal skills, being able to self-soothe, being able to get yourself through an emotional crisis. There are a lot of different skills that are taught in that type of therapy that are very effective. Cognitive behavioral therapy really looks at the person's thoughts and assumptions and helps them to come up with alternative thoughts and behaviors that will be more helpful to them, for example.
Now, you also spoke about hospitalization, when the patients need to be hospitalized.
Mm-hmm. We always collaborate with our client's physician. We make sure that they're being seen by their physician regularly and that we're communicating with the physician so that if labs are not looking good, the person's blood pressure is too low, for example, if they're not medically stable, then we work with the physician to get them into a higher level of care. So some people find that outpatient treatment is just simply not what they need right now. And what they need is more support, more supervision, more help than once a week therapy can offer. So in that case, we'll help them get to a treatment center where they can spend a few weeks or a few months with more intensive treatment. And once they stabilize, they come back to outpatient therapy with us.
And when you say intensive treatment, what does that mean? Well, what do they do in those facilities?
Sure. So in residential or inpatient treatment, the person is there, again, for a number of weeks or months. They have their dietitian, their therapist, group therapy, psychiatry, all in one place. They're monitored and supported around the clock, participate in an all-day treatment program involving group therapy and supervised meals and things like that. Again, it's really intensive so that they can get back on the right track fairly quickly. It's not necessary for everyone. Not everyone wants or needs to participate in that level of treatment. But again, when people come to us for a comprehensive assessment, we let them know what level of care we think will be best for them right now.
So I feel that when we find someone with an eating disorder, we want to help somehow. It's in our nature. There is something we want to say, something we want to do. What should we do and what shouldn't we do? Because I feel that sometimes, as we are trying to help a person with an eating disorder, we can make it worse.
Okay. So I would say maybe we could start with what not to do.
Okay.
I would say that making comments about people's body weight, shape, or size is usually not helpful. I think depending on who it is, listen, if it's your child, you just have to get them into therapy or into some kind of treatment really quickly. That's really the best thing to do. And they don't have to, it's better not to wait. In fact, don't wait until they realize they have a problem or want help or ask for help. You don't have to wait for that to happen. And it usually doesn't happen, at least not in the way you think it will. And it's okay to bring them to therapy or treatment without them totally being on board or realizing that they have a problem. It's okay. So I would say that's probably the main thing to keep in mind. I think that if it's, a friend or a spouse or somebody like that, I think just talking to them really frankly about what you're seeing and what your worries are, providing them with resources. I actually had sent you a list of resources that I can also send out to the group.
Yeah, I will be sending it with that recording, definitely.
Thank you. Sharing that with your loved one can really be helpful as well. Yeah. For most people, a combination of seeing their regular physician once to twice per week of therapy and seeing a registered dietitian, usually that combination of things is really, really helpful.
Now, you just mentioned children. So, for a lot of us who might be mothers, of course, we are concerned if we see that our kids are not gaining enough weight or gaining too much weight. And we want to make comments about it and we want to help our children. So what's the best way to do that without incurring into developing an eating disorder? Especially if they're girls. I don't know. Is there a difference between girls and males in this case?
I would say not. No, I think that most people are more aware of how their daughters perceive themselves than their sons. But it's important for parents to know that boys and girls get eating disorders. We see them both in our practice. I think it's really, really important for adults to speak in a way that's positive about their own bodies, to not exhibit dieting kinds of behaviors around their children, to really have an attitude of all kinds of foods are good for us and things like that. To not make comments that are negative about your own body around your children or other people's bodies. I think all of these things are really helpful.
Mhm.
Yeah.
I don't know, any other things that you would like to share? Or, sometimes we like to know about cases that you have encountered in your practice that you would like to share a story with us.
I mean, I can talk, I guess, in a general way, since we're talking a little bit about kids, I can talk in a general way about how we work with teens and older kids.
Mhm.
So again, before I was talking about family-based treatment, which is an evidence-based way of treating anorexia nervosa in teens and children. And again, it can be adapted to different populations and different diagnoses. But I think we get a lot of calls from parents who are concerned about their child having an eating disorder and they don't know what to do, right? So I want parents to know that when you start therapy or treatment for your child's eating disorder, if you don't know what's going on in therapy, if you're feeling out of the loop, if you have no involvement in their recovery, that's really sort of a red flag, right? We include parents a lot. We want parents to feel empowered to do something about their child's eating disorder. We work really closely with parents and families. We offer them a lot of support and education about what to do at home, as well as what not to do, right? So that they don't have to just stand by and watch this happen, because things go downhill really, really quickly. And it's really scary for parents and they feel really ineffective. And we don't want that ever.
Mhm.
So I think, yeah, that's sort of, I guess, a start. If you want me to talk a little bit more about that, certainly I can.
Yeah, go ahead.
Okay, sure. Yeah. So family-based treatment really takes place over 3 stages. So the first stage of family-based treatment is high parental involvement, right? We want parents to be making choices for their kid about what their child will eat, how much, and for their child to not be isolating with food anymore. So a lot of parents come to us really worried because their kid has been, skipping meals, won't eat this, won't eat that, lying about what they've eaten, right? So we really remove that isolation and we really get the parent and the child eating together again. We want to sort of replicate in that stage what would be happening at a treatment center. But in the absence of a treatment center. So instead of sending your kid out of state to be treated by, dietitians, therapists, nurses, who are all wonderful, right? Sometimes that's not necessary and you can really replicate that at home. So parents are monitoring, parents are doing the feeding, et cetera. A lot of people think there's no way my kid will go for this. I don't have the energy to do that. It seems age inappropriate, things like that. And I want parents to know you can do that. It's really the most helpful and compassionate thing to do. It really does work. If you're unsure about how to do it, and you will be. I mean, I like to think of this as sort of the most complicated and the easiest thing at the same time. It sounds easy enough, like, okay, I'll just be in charge of what they eat now. Wow, it's really complicated. A lot of families find that when they start doing this, they're really confused about exactly how to do it, or what do I do if my kid is saying no, or they run out of the house and they won't listen. Listen, we support you with all of that. We know what to do. We help you. So that's really the first stage of treatment. In the second stage of treatment, we start to hand back some responsibility and some control with food back to the adolescent in incremental ways. And again, that's all part of the therapy. So that age appropriate independence can start to come back. Really what we're doing in stage 1 and some of stage 2 as well is to stop things from getting any worse. Things will start to get better, right? And we're really working on stabilizing so that these medical consequences and things like that are no longer happening. We find that when the person is eating better and gaining weight and all of that, a lot of the psychological issues that the parents were seeing, the depression, increased anxiety, behavior problems, things like that, start to go away. And they really start to see the child that was there before, you know. So.
And Christine, are there any medications that you need to take for an eating disorder?
So not specifically for an eating disorder, and that's a really good point. For a lot of people, the food really is the medicine, and it's that restoration of normal eating and physical health that can restore a lot of the psychological symptoms. But if somebody has also another mental health condition, something that was pre-existing, co-occurring, things like that, then medication can be really helpful. Yeah.
And you know, as you were talking, I was thinking, then what would be, how old can you be to develop an eating disorder?
Oh, well, we see eating disorders in kids as young as 8, especially actually even younger than that. With avoidant restrictive food intake disorder, that starts often in early childhood. Really, there's no upper or lower age limit on eating disorders. We most commonly see them developing in early adolescence, but again, it can happen at any time.
And, you know, being that it could happen at any age, any stage, how do you differentiate between picky eating and an eating disorder?
Okay, so for example, with avoidant restrictive food intake disorder, when is it picky eating and when is it an eating disorder? Okay. So with picky eating people grow out of usually, or picky eating usually doesn't affect the person socially, psychologically, and doesn't usually cause any health problems, right? So if I just have preferences and, you know, I don't like vegetables, I'd rather not, and I just like chicken nuggets, and that's kind of how I live my life, that might be okay, right? But if I can only eat chicken nuggets, for example, and that's a really common food that's tolerated, typically with what we see with kids with Arfid, and it's causing a lot of anxiety and social problems. You know, I can't eat at a friend's house. I can't eat anything else. I have anxiety. I throw fits when I can't have this food, for example. That's really when it's crossing the line. And in terms of avoidant restrictive food intake disorder, often the list of tolerated foods becomes so narrow that the person, again, can become dependent on supplements and like Ensure and things like that, just in order to maintain kind of any level of health, for example.
Mark is asking, how does ADHD impact eating disorders in an adult?
In an adult? So I guess the first thing I think about is stimulant medications and how they can affect someone's appetite. If someone is not eating enough for any reason to begin with, right? And they sort of go into a negative energy balance, and they lose an inappropriate amount of weight or whatever, and that person was at risk for an eating disorder to begin with, that's often where you'll start to see it, you know, turn into a full-blown eating disorder, again, with a lot of anxiety around food and body image and things like that. We do know from the research that people with ADHD are more prone, again, for a lot of reasons, neurological things, to binge eating disorder. People who are not neurotypical in general are more prone to avoidant restrictive food intake disorder. Mark, I'm not sure if that answers your question. I don't know.
It's, you know, interesting to me because there are so many different types of eating disorders. So, and you were mentioned that you have this tool to help diagnose eating disorders. So is there like one single tool that you use? And then how do you know which type of eating disorder it is?
Well, yeah, there are standardized, you know, ways of diagnosing. It's really based on the diagnostic criteria in the DSM-5.
Okay.
Yeah.
And does body shape have anything to do with eating disorders? You know, I feel that a lot of times, you know, if we see somebody being very skinny, then, oh, she might have an eating disorder, or he might have an eating disorder. But also, you know, if somebody is very large, then we also are prone to think, oh, they have a binge eating disorder or something like that. Is that true? Is like body shape has something to do with it?
Diagnostically, the only eating disorder where body weight is part of the diagnosis would be anorexia nervosa. Other than that, people with eating disorders can be any weight, shape, or size. And people without eating disorders can also be any weight, shape, or size. So that alone is not really enough to diagnose.
Mhm.
Yeah.
Okay. Well, I'm running out of questions here, and we're now getting a lot of questions from our attendees. So actually, we have a little bit of time. Is there something else that you would like to talk to us about eating disorders, Christine?
I don't think so far, but maybe something will come up when
Mhm.
I'm answering the questions.
Yes. So talk to us about those resources. And again, I'm going to send a list of resources to everybody. So what are they? Where are they?
Okay. So I think I made this list a few weeks ago, so I'm trying to
Yes.
recall what's on it. There are, so my contact information is on there for my practice. Let's see what else. We have a list of support groups that are free, that people can attend online. Some of those are parent support groups as well. Let me see. I have a book that walks people through the basics of family-based treatment, which is what I was talking about before when I was talking about an evidence-based way of treating adolescents with anorexia. The book by Dr. Lauren Mulheim, When Your Teenager Has an Eating Disorder, that's a great book for parents. It's a great starting point. What else is on the list?
You have also 8 keys to recovery from an eating disorder.
8 Keys to Recovery is a really good one. That was written by a clinician who treats eating disorders and is also a person who has recovered from an eating disorder. That's a good book for people who themselves are struggling, for older teens and adults. There's also a workbook that goes with that resource. So that's a really good one.
You have also reading here the Eating Disorder Trap, a guide for clinicians and loved ones.
Yes, that's a good resource. That was written by a registered dietitian. It's really comprehensive. I teach a class on eating disorders at Dominican College, and I think I may be using that as one of my textbooks for the class. Yeah.
Are there, and you were mentioning some support groups. So what do you know about these support groups? Are they free? Do you need to register? Do you know anything about them?
So the resource that I have listed there, I believe those eating disorder support groups are free. There are a lot of things like that in the community. We from time to time offer support and treatment groups as well. That resource though is really general. I don't think that you have to do any kind of intake or meet any kind of criteria to participate. I think you can really just pop in. So it's going to be a really general kind of a group. If you're looking for something more specialized, you can always contact us and I can point you in the right direction. If we don't offer it, I can show you, point you in the direction of who does.
And Christine, I don't know if you knew this, but here at Montefiore Nyack, we actually have a support group. It's called Overeaters Anonymous. And it's for people also with eating disorders, but more on the overeating side. People who have gained a lot of weight and they're trying to lose weight by managing eating disorders. So it's not just a matter of dieting or anything like that. It's really, it follows the Alcoholics Anonymous kind of premises. It's very interesting. A lot of people have joined the program and a lot of people have not only recovered from an eating disorder, but, managed to accomplish a healthy weight and maintain their weight. So, and it's every Saturday here at the hospital.
I'll sort of reserve my judgment and my opinion on that.
Mhm.
I think that if it works for someone, then wonderful, right? Then that's great.
Yeah. Yeah. It's different resources that we have, right?
Yeah.
Good. So let me see if we have any other attendees here, other questions. I don't think so. So next week, we're going to be actually talking about, I forgot now, immunizations. Immunizations. So, you know, with all of this about COVID and everything and the flu, everything that is happening, we're going to have an expert on immunizations, how vaccines are done, and what is the pros and cons about vaccines and all of that. And we're going to dedicate a lot of time to talk about the COVID vaccine as well. How is it done? And you know, a lot of molecular stuff. Is a very interesting chat. So I hope that you can attend, and maybe a lot of our attendees from today can attend as well. And Christine, thank you so much.
Thank you very
Being
much.
with us today and spending the time. It's really great that you're with us and that we have you nearby. And I'm for sure gonna send your information and all the resources that you sent us together with the link, either later this afternoon or tomorrow. We'll see how it goes with my schedule. But thank you so much. And it's been a pleasure to meet you. And thank you to all of our attendees for sharing time with us today. And I'll see you next week.
Great. Thank you.
Thank you. Bye-bye.
Bye-bye.